Hello, my name is Katie and I'm a pharmacist, and today we will be talking about the use of donepezil in dementia. Dementia affects 750,000 people each year in the UK. It is an umbrella term which describes a large group of symptoms caused by diseases such as Alzheimer's disease or a stroke. Dementia is not a disease or a natural part of ageing. Symptoms of dementia include memory loss, difficulties of thinking, problem solving, or language. Dementia is a progressive condition, meaning that it gets worse over time. In the brain of a person with dementia, there are low levels of a chemical called acetylcholine. Acetylcholine helps send messages between certain nerve cells. In dementia, there is also a loss of these nerve cells that use acetylcholine. Reduced acetylcholine levels and progressive loss of nerve cells are linked to worsening symptoms. Donepezil is the first choice drug for dementia. Donepezil prevents an enzyme from breaking down acetylcholine in the brain. An increased concentration of acetylcholine increases the communication between nerve cells. This temporarily alleviates or stabilizes some symptoms of dementia. There is yet no cure for dementia. Donepezil can help reduce anxiety, improve motivation, improve memory and concentration, and improve your ability to continue daily activities such as shopping or dressing. It is not clear whether donepezil helps to treat behavioural changes such as agitation or aggression, as trials in this area have given mixed results. However, as mentioned previously, donepezil is not curative treatment but will delay the progression of dementia. Every drug has unwanted effects. You may not experience all or any of these unwanted effects, and some of these are experienced more commonly than others. Possible unwanted effects include nausea, vomiting, diarrhea, muscle cramps, fatigue, and insomnia. If you experience any of these unwanted effects, please inform your doctor or pharmacist, and we can work together to try and lessen these symptoms. Side effects may be able to be relieved by lowering the dose on advice from the doctor and switching to another therapy. Some unwanted effects may be more serious than others, including a fever with muscle stiffness, black stools, stomach pain, or fits. You must tell your doctor immediately if you notice these serious unwanted effects mentioned. If you have any concerns or notice any other changes since starting your medication, please seek help or advice. Donepezil is available in 5mg or 10mg tablets. It is to be taken once a day, usually at bedtime. Treatment is started at 5mg a day and is then increased to 10mg a day after 1 month if necessary. The maximum licensed total daily dose is 10mg. If you miss a dose of donepezil, you should take it as soon as you remember, as long as it is on the same day. If it is the next day, you should make sure that you don't take 2 tablets, but you should continue with your normal dose. Do not take more than 1 tablet each day. If you take more than 1, you should call your doctor immediately. If you cannot contact your doctor, contact your local accident emergency department as soon as possible. Some medicines can interact with donepezil by weakening or enhancing the effect of donepezil. If you are taking any other medications, including medicines which you buy over the counter, such as vitamin drops, eye drops, inhalers, injections, you must tell your doctor. Drugs such as antidepressants, painkillers such as ibuprofen, antibiotics or herbal medicines can also interact. If you're going to have an operation that requires you to have general anaesthetic, you must tell your doctor and the anaesthetist that you are taking donepezil because your medicine may affect the amount of anaesthetic needed. Donepezil should not be taken with alcohol because alcohol may change its effect. Medication should be reviewed regularly and continued for as long as the benefits outweigh any side effects. If you decide to stop taking donepezil, you should speak to your doctor first if possible, as soon as you can before stopping the treatment. Treatment may also be stopped by agreement with the doctor if you become unable to take the medicines prescribed, even with support. If you stop taking donepezil, your condition may worsen rapidly. If you have stopped and would like to restart your medication, you should contact your doctor as soon as possible. Both dementia and donepezil may impair your ability to drive or operate machinery, so you must not perform these activities unless your doctor tells you that it is safe to do so. You must also inform the DVLA that you have dementia, and they will give you the appropriate advice and any paperwork that you need to complete. It is important that you tell your doctor or pharmacist the name of your caregiver. Your caregiver will help you to take the medication as it is prescribed. There are Age UK and Dementia UK who will support you with straightforward information about dementia and offer you practical advice and simple strategies for adapting to changes you may be going through, both social, physical, and psychological. You will need to see your doctor from time to time to review your treatment and assess your symptoms. If you do have any questions about Donepezil or dementia, contact your pharmacist or GP. And remember that you are not the only one out there with dementia, and there's help and support available to you. Thank you for watching.